Hi Tori, how are you?
Good, how are you?
I'm very good. So I know that I haven't seen you in a little while, but I have seen you in the past, so could you just go ahead and verify your date of birth for me?
December 7th, 1999.
Okay, wonderful. Okay, and you're here for a head-to-toe exam. Is there anything else that's been bothering you today or any concerns?
My knee has been bothering me when I walk. And my lower back.
Okay, so your knee and your lower back. First of all, did the symptoms start at the same time?
I think my back first.
Your back started. Okay, and then your knee a little bit later. Okay. Do you remember if this pain followed any inciting incident, like any falls or anything strange that happened?
No, I don't think so. I've been working more though lately.
Okay, so maybe just the stress of working. Do you work on your feet a lot? Okay, that makes sense. And for your knee, what kind of pain is it? Is it throbbing or aching?
It's aching.
Okay, it aches. Sorry about that. Is it persistent throughout the day? Okay. Is going down the stairs difficult for you?
Yeah.
I'm sorry about that. What about walking?
A little bit.
Okay. So walking as well. And on your back, does that hurt any particular time of day?
It's worse when I get up in the morning.
Okay. So first thing in the morning. And does movement also exacerbate the back pain as well?
It does.
Okay, sorry about that. Okay, well, before I take your vitals, let's go ahead and just take a look at your knee. So is this one right here?
Yeah.
Okay, so I'm just going to go ahead. I'm going to put on some gloves, actually. Okay, so I'm just going to touch here slightly to the side. Does that hurt on this side or?
A little bit.
Okay, I'm just going to feel all around. And let me know when the pain increases because it could be an issue with your kneecap in the middle.
Probably there.
There? Okay. Definitely feeling a creaking sensation here, so it just seems like a lot of stress. We'll go ahead and take a closer look during the exam, but I just wanted to feel it. Okay, let me get on a stethoscope and take a listen.
Okay.
Okay, I'm just going to very gently move the knee. Okay, I'm hearing a lot of activity here. Gently place my stethoscope here. I'm going to okay, and on the side. Okay. Just gonna go ahead and okay. Okay, some sore reactions here. I'm feeling a little bit of swelling. Okay, yeah, definitely some irritation there. On the left knee. And on your back, is there a particular side of your back that hurts the most on your lower back, or is it both sides?
Both sides.
Okay, could be an issue with your sciatic nerve, but I'll take a closer look later on. So I'm going to go ahead and take your vitals, and we'll just begin the exam.
Yeah.
Listen to your heart. So, oops. All right, so just feeling here. Okay. Okay, very good. Feels healthy. Listening on the bell side for any murmurs. Okay, no murmurs present. I am going to just quick listen to your back, but you don't have to move. I'm just gonna go behind you real quick. Okay. So go ahead and take a few deep breaths for me. Another one. Good. And just one more. Okay, great. Okay. So no concerns there. Any issues with breathing, difficulty in catching your breath? Okay, good. Okay, I'm gonna take your temperature now. Okay, 96.2. That's good. Okay. And your oxygenation. Okay. Okay, good. 98% of room air. Your heart rate is about 85 beats per minute. Slightly high, but you did go up some stairs to get here, so that makes sense. Okay. Next, I'll do your blood pressure. Go ahead and give me your arm here. It's a really cute dress you have.
Yeah.
Okay. Okay. Okay, 108 over 80, so that's normal. Okay. All right, great. I'm just gonna slide this off if we can. There we go. Perfect. Okay. All right, great. Okay. Just going to start with some palpations and percussions. Also just going to examine your skin here. Okay, sorry about the bright light. Okay, your skin is very well perfused. Great. I don't see any discoloration. Okay. I'm just going to feel with my fingers. Sorry if my hands are a bit cold. Any pain here in the jaw? Okay. Preauricular lymph nodes are non-palpable. I'm going to check right behind the ear. Good. Just gonna check your thyroid right here on one side. Okay. Go ahead and try to raise your eyebrows for me all the way. Okay, good. Now raise them all the way. Try to lower them. Okay, good. Now turn your head to your left in 3, 2, 1. Good. Turn your head to your right. Okay, good. Same, just going to use a different point of pressure. Okay, opposite way. Alright, very good. Skin feels normal to the touch. I'm going to do some percussions here. Okay. Just gonna pull down on your ears. Let me know if you feel any pain here.
No.
Okay, and back.
No.
Alright, and up. Any pain?
No.
Okay, great. Now put your hair back. Okay. Good. So, just gonna write that down. Okay. So I'm going to give you 3 words, and I want you to remember them and forget them, and I'll ask you about them later.
Okay.
Ornament, pen, and zebra.
Okay.
Okay? Ornament, pen, and zebra. Okay. I'm going to go ahead and take a look inside your mouth. Okay. Okay. Good. Your gums look pink and moist and healthy. Go ahead and lift your tongue for me. Very good. Don't see any signs of cavities or infection. Kind of just look at the roof of your mouth. No sores. No discoloration. Great. Okay. You're having a few viruses going around right now, so I'm just going to take a swab inside your cheek.
Sure.
Just so we can test you for anything airborne. Okay. Great. Okay. Let's do a taste test next. Okay, go ahead and taste the strip. Close your mouth, open. What does that taste like to you?
I don't think I taste anything.
Okay, good. That was control paper. Okay, then this one. Okay. All right.
It's better.
Better? Okay. That was supposed to be sweet. So I'll just make note of that. Okay. All right. Let's go ahead and see what your smell is like. I have some, just a few aromas for you to smell.
Okay.
Go ahead and inhale. What does that smell like to you?
It smells kind of vanilla.
Yes, that's vanilla. Good job. Okay. Okay, what does that smell like?
It smells like a flower.
Yeah, jasmine.
Oh, jasmine.
So far, so good. Okay. Go ahead. Inhale.
Lemon?
Close enough. Orange. Yeah. This one's a bit trickier, but go ahead and do your best with it.
I'm not sure.
That's okay.
Kind of like a flower again.
Okay,
but
yeah.
I'm not sure.
Chamomile.
Oh,
So more of a
chamomile.
herbal scent. So I think you're on the right track. This last one should be pretty distinct.
Mint.
Yes, peppermint. Good job. You passed the smell test. Okay. So next, let's go ahead and look at your eyes and your ears. Okay, I'm just going to take a look inside your eyes first. Okay, go ahead and pick like a point on the wall, stare straight ahead. So you can just look inside your eyes. Pupils are round and reactive to light. Normal in color. Look up. Look down. To your left. To your right. Okay, good. Any eye pain? Are you seeing things okay?
Yeah.
Great. When's the last time you went to an eye doctor?
Probably a year ago.
Okay. All right. As long as things are good. Do you wear contacts or glasses?
I do.
Okay. And your prescription you're pretty happy with? Okay. I'm going to look at your other eye. Go ahead and look straight ahead. Look up, down, to your left, to your right. Okay, and open your eyes wide. Good. Pupils are round and reactive. Okay. If you could go ahead and take the smelling chart and hold it at arm's length. Just going to have you read some things here. What about this row beginning with the D?
D, H, J, B, S.
Good. And the last row beginning with the L.
L, T, F, F, H.
Okay, so that was a P in the middle.
Oh, you're right. I don't have my glasses on.
Yeah. Okay.
So that
okay.
makes sense.
That definitely makes sense. Go ahead and read it backwards.
H, P, F, T, L.
Good. What color is this?
Green.
What's this color?
Red.
Good. And is this circle number 8 larger or smaller than circle number 3?
Larger.
And is circle number 3 larger or smaller than circle number 2?
Larger.
Good. What's this big letter up here?
E.
Okay. Good. Okay, so before I have you laid down, we're going to go ahead and do a sharp and dull test. Okay, so go ahead and close your eyes. This is a sharp sensation, and this is dull. So go ahead and say sharp or dull depending on which one you feel, okay?
Okay. Sharp.
Good.
Dull.
Okay.
Sharp. Sharp. Dull.
Good.
Sharp. Sharp. Sharp.
Yes.
Dull. 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 Sharp. 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 Sharp.
Good. Okay. So I'm going to go ahead and have you laid down and we'll continue the exam.
Okay.
Yeah? Okay, Tori, so next I'm going to go ahead and take a look inside your ears.
Okay.
How's your hearing been lately?
Good.
Good. Okay. Okay. Go ahead and turn your head this way. Perfect. Okay. Definitely got a lot of wax in there. Okay. You can still see the tympanic membrane. It's a nice pearl gray. Okay. No signs of infection or redness here. Go ahead and look at the outer side. Okay. Now go ahead and turn your head facing me. Okay. Same here, just a little bit of wax buildup. Do you mind if I just clean a little bit of that out today? Okay, good. And I'll just look on the sides. No itching of the ears or pain?
No.
Okay. Going to just okay. Just adding a little bit of solution here to this paper just to disinfect. Okay, go ahead and turn your head this way. Perfect. Alright, just turn your head just a little bit further this way. Perfect. Okay, go ahead and bring your face to center. Perfect. Okay. Alright, I'm going to give you two options. Let me know which sound is louder, closer to you, option A or option B.
Okay.
And go ahead and keep your eyes closed. Here's A. Here's B.
B.
Good. Here's A. Here's B.
A.
Good. Let me know which sound is above you, if the sound is above you, below you, on your left or your right. Okay.
Left. Right. Above.
Good.
Below.
Good. And of the three words I just gave you, could you repeat those for me?
Ornament, pen, and zebra.
Good. Okay. I'm going to be placing a vibrational instrument on your forehead, and also on your shoulders and maybe your chest. Let me know when the sensation of vibration stops.
Okay. Stop.
Good.
Stopped. Stopped. Stopped.
Okay. Just going to do the same thing, but with a different tool. Let me know when it stops.
Stop.
Okay, excellent. Okay. Next, we'll do a pressure point test. Let me know if you feel one or two pressure points at the same time on your face, okay? So this is 1, and this would be 2.
Okay.
Okay.
1, 2, 2, 1, 1, 2, 2, 2, 2, 1, 1, 1, 2, 2, 2, 1, 2, 2, 1, 1.
Great. So I'm going to take some measurements of your face and record them for symmetry.
Okay.
So close your eyes and just relax. I'm just going to see if there's any swelling that I missed. 5 centimeters. 5, 6. Going to just look on both sides of the face. That's right here. And the same here. Symmetry in the center side. Okay. Go for the forehead. 6 centimeters here. And then 6 on this side to the hairline. on the side of the face. Chin to the ear, that's about centimeters through there, 10.5. And on the other side, it's about 1.5. A little bit of asymmetry there, but not concerning because I'm not seeing any swelling there. Any pain here when I press?
No.
Okay. Going to just go ahead and put her hair down this other side over. Okay. Side of the face. Okay. And that's about equal. Equal on both sides. Okay. Look right here. In the center is about centimeters and 4.5. All normal. Okay. All right. So I'll go ahead and take a quick look at your scalp.
Okay.
And then we're going to pay more attention to, of course, your leg and your back as well.
Okay.
Okay, so we just want to rule out any problems in the scalp area. Go ahead and lift your head for me if you could, just real quick. I just want to get the back of the hair. Perfect. Just going to be looking with a lice comb and a light to see if there are any issues here. I'm just going to tap gently with my finger. Do you have any pain or itching here?
No.
Okay. Any pain or itching?
No.
Okay. Your head just one more time. Just make sure I'm getting all the area here. Just checking along the scalp. I'm seeing some flakes here, but not too much. pretty healthy there in the scalp. Do you feel me tapping here? Okay. Alright, I'm going to be scraping with my tongue depressor here. Let me know if you feel it once, twice, or 3 times, okay? Say 1, 2, or 3.
3.
Okay.
2.
Good.
1. 1.
Good.
Alright.
Okay. And around now.
2.
Okay.
2. 2. 1.
Good. Okay, I'm just going to add a little bit of moisture here because I'm seeing some dryness in the flakes. Just going to brush it through here. Just provide a little bit of relief. Okay, I'm just gonna take this out here. Okay, just examining this section. Don't see any irritation. Just gonna look up here along the hairline by your bangs. No real issues here. Just a few flakes. Okay. We're gonna do one more test. Okay, so it's gonna be sharp here. And this will be dull, okay? So say sharp or dull. Okay.
Sharp.
Okay.
Sharp. Sure.
Good.
Sure.
Mm-hmm.
Mm-hmm. Full.
Good.
Sure. Sure. Sure.
Okay. So that went okay. Next, I think I'm going to have you put on a hospital gown and flip around.
Okay.
And we're going to take a look at your back, okay?
Okay.
Okay. Sorry, it's going to feel just a little bit cold. Okay, just sitting to all sides. Okay. Just going to palpate the back, just feeling along the spinal discs, making sure that there's alignment here. Okay. No abnormal curvature is detected. Let me know if there's any sharp pain. Just feeling the individual discs. Okay. Any pain here on the side? Okay. Any pain here? Okay. Pain here closer to the lumbar spine? Just a little? Okay. And here? Okay, so we're just going to focus on both sides. That's where the pain is on the lower back. Okay. Going to be doing some percussions as well. Sorry, that was painful. Okay, just need to feel hear the reverberations. I'm going to go ahead and take a look at the skin here. Not seeing any hardness. I don't see any one side of the back protruding from the other. So that's good. It seems to be symmetric, but I'll take measurements to be sure. Okay, I'm just gonna take temperature on both sides. definitely the left side is a little bit higher, so I'm going to just make a note of that. Have you been taking anything for the pain? Okay. I might do some skin pulling here and prescribe some ibuprofen. Okay. So 7 here. Some edema on the left side for sure. Okay. Okay. Just really curious about this side as well. Yeah, definitely a lower temperature on the top. Okay, just going to do some measurements on your thoracic spine to be sure. 16 inches and 10 centimeters. That is 10 inches. I'm going to write that down. Okay. Cervical spine up here. Tummy. Okay, tummy movement. Saw some slight asymmetry here due to inflammation of the left side. I'm just gonna get the centimeters right here. That's about 11. Okay, and we have 10 on the sides. It's about 1 centimeter elevated. Okay. I'm going to do some very light skin pulling just on the base and then apply an activator tool just to kind of realign and reset the lumbar spine, okay? You don't have to do anything, just relax. But I just add a little bit of moisture beforehand. Okay. did not feel any pain. Just feel like a little reset here. Go a little bit higher in here. This spot, this spot. Okay, just going to do some skin pulling along the upper spine, just to encourage that growth to follow up from the base to the thoracic spine. Okay. Okay, is this starting to feel a little bit better? Okay, that's great. I'm just going to go ahead and do something similar just to the knee area here. I already examined it visually and I did see a little inflammation, but I'm just going to reset it with my tool and then go ahead and look at the feet as well, okay? And then we'll be done. Okay, pain here. Okay, just gonna go ahead and use the tool, just resetting the area here. Just gonna feel the pressure, it might be a little funny. So on left side, and here we have just same thing on the right. It's a little less inflamed. Okay. Just gonna palpate. Just gonna gently. That's okay, that's okay. That's all right. Let's keep them on. Stay warm. Okay. Just gonna take off. Okay. And just feel here. Any pain here in the foot?
No.
No? No aching?
Maybe a little bit on the heel.
Okay, all right. What about here in the ankles?
A little bit.
Okay. I'm just going to add a little bit of pressure here, although I don't think this tool it's more made for the paraspinal muscle. Okay. Doing a Babesia response test. Okay, that's our response up here. Just going to look at the other side. Okay. Is it the same pain on this ankle or is it not as much? Okay. So it really is right ankle there. Different response. Okay. Normal reaction. And just a slight pressure. Okay. Just gonna put these back on. Sure. Okay. Okay, Tori, so I finished the exam. You're doing really, really good. You're healthy. I applied some preliminary treatment to the back and legs, although I can refer you to a specialist if the pain persists. I am going to write you a note to get you off of work for the next 3 months.
Oh my gosh.
So you have to go to work for a long time and you still get paid.
Well, thank you.
So that'll be great. I just think you need a lot of rest, and I'm a doctor, so I can just make that happen.
I love that.
Okay, wonderful. Well, we'll see you again next time, and thanks for coming in.
Thank you.
Okay.